Imagine a hidden truth, whispered only in the quiet corners of medical journals, a truth most doctors will never share with their senior patients. Every year, millions of elders faithfully undergo health checkups, believing they're safeguarding their well-being. But what if I told you some of these routine tests, the very ones your doctor insists you need, could actually be pushing you closer to a surgeon's knife, a life-altering stroke, or even the devastating diagnosis of cancer? Startling new research reveals that a staggering 37% of medical tests administered to seniors lead not to health, but to unnecessary treatments, debilitating complications, or even irreversible side effects. And here's the truly shocking part. A mind-boggling 99% of individuals over 70 are completely unaware they are being over-tested. One particular checkup, the #1 culprit on our list, is directly responsible for a chilling 5% of all cancer cases in the U.S., a figure tragically on par with daily alcohol consumption. You won't find this warning on clinic billboards, nor will your doctor likely volunteer this information. But the truth, raw and undeniable, is buried deep within the scientific literature. Today, we're not just uncovering it, we're exposing it all. In this urgent report, we reveal the 5 health checkups you absolutely must avoid after 70 and the terrifying potential consequences they hold for your body, all meticulously backed by verifiable science. And you truly won't believe what made it to #2. Before we dive in, tell us in the comments, where are you watching from? How old are you? And have you ever regretted a medical test or procedure? Do you believe seniors are subjected to too many tests? We're eagerly reading and responding to every single comment with personalized insights and advice. And please smash that like button and subscribe to our channel for more vital health revelations like this one. Now, without further delay, let's unveil the first test, one that seems utterly harmless but can insidiously erode your quality of life. Number 5. The bone density scan. It sounds benign, doesn't it? A quick, painless scan, no needles, just a simple walkthrough to assess your fracture risk. But here's the crucial detail no one tells you. Past the age of 70, a bone density scan frequently generates more anxiety than actual benefit. This scan, formerly known as a DEXA scan, measures bone strength, primarily to detect osteoporosis. Yet for older adults, particularly women, the results almost invariably indicate lower density, even when no genuine danger exists. This is simply because bone loss is an inherent part of aging, as natural and inevitable as developing wrinkles or gray hair. Despite this, many seniors find themselves pressured into medications like bisphosphonates, drugs meant to strengthen bones but notorious for severe side effects like osteonecrosis of the jaw, where the jawbone literally dies, and esophageal irritation. The critical flaw? Studies conclusively show that treating mild bone loss in those over 70 with medication has negligible impact on actual fracture rates. A groundbreaking study in the Journal of the American Geriatric Society, tracking over 1,200 women aged 70 and above, revealed bisphosphonates reduced fracture risk by a mere 0.3% over 5 years. While not entirely insignificant, it's far from a life-saving intervention. Instead, these women were disproportionately afflicted by medication side effects, digestive distress, inflammation of the esophagus, and paradoxically, bones that fractured in unusual ways. Consider Rose, a vibrant 76-year-old retired piano teacher who, despite no falls, no pain, and daily walks, was referred for a DEXA scan after her routine checkup. Her scan returned osteopenia, a mild bone density reduction, not osteoporosis. Her doctor, however, immediately prescribed alendronate, a bisphosphonate. Within 3 months, Rose suffered severe reflux and agonizing jaw pain, her piano silenced for weeks. We intervened, taking her off the medication and initiating a regimen of vitamin D, weight-bearing resistance band exercises, and a calcium-rich diet featuring sardines and leafy greens. A year later, she was back to virtuoso performances, her legs stronger, her balance improved, and not a single fracture in sight. For healthy individuals over 70, not prone to falls or fractures, a quick scan is less effective than embracing a lifestyle centered on strength training, balance exercises, proper nutrition, and vitamin D correction. A 2022 Osteoporosis International study confirms these lifestyle changes reduce fractures by over 20%. Never allow a number on a screen to terrorize you into unnecessary treatment. But there's one scan that can lead to something far more horrifying: brain surgery. Let's delve into that next.
Number 4. The brain MRI for memory loss. When seniors experience forgetfulness or confusion, the gut reaction is often profound fear, fear of dementia, fear of Alzheimer's. Consequently, doctors frequently order a brain MRI. But here's the uncomfortable truth. These detailed brain scans rarely provide the answers patients desperately seek. In fact, most MRIs in individuals over 70 simply reveal age-related changes, minor shrinkage, or white matter spots, which are entirely normal for older adults. Yet once these spots are identified, they can trigger a devastating cascade of fear, further intrusive tests, and even unnecessary surgery that may not improve memory and can, in fact, worsen the situation. A 2021 study in Neurology Today, analyzing over 3,000 MRI scans from patients aged 70 to 85 with mild cognitive complaints, found 86% showed some brain abnormality. However, a mere 3% of those findings were linked to an actual treatable condition. This means a staggering 97% of individuals endured the emotional trauma of being told something is wrong when in reality nothing truly was. Even worse, almost 12% were subjected to invasive procedures like spinal taps or exploratory biopsies, all based on ambiguous scan results. Meet George, a sharp 74-year-old retired engineer who, worried by occasional misplaced keys and forgotten names, was sent for an MRI that revealed white matter changes. He spiraled into panic, convinced he had dementia, withdrawing from driving and church. His anxiety worsened dramatically over months. But when we reassessed him with a standard cognitive test, his score was perfectly normal. We clarified that his MRI findings were age-appropriate and guided him toward lifestyle interventions, optimized sleep, proper hydration, and engaging brain games. Within 3 months, his memory had stabilized, and he felt entirely himself again. The truth is, without severe neurological symptoms like seizures, sudden personality shifts, or rapid functional decline, an MRI offers little benefit for mild memory loss. A far superior first step is a cognitive screening test, a simple paper-based exam evaluating memory, attention, and problem solving. It's inexpensive, effective, and crucially, it avoids the risk of inducing unnecessary panic. Now, brace yourselves, because the next test on this list is one you've likely undergone multiple times, and it holds the number 3 spot for a very alarming reason.
Number 3. The cardiac stress test. It's a ubiquitous test for seniors reporting mild fatigue, occasional chest tightness, or simply feeling not quite themselves. The cardiac stress test, which monitors your heart during simulated exercise on a treadmill or via medication, aims to detect blocked arteries. However, after 70, particularly for those without clear heart disease symptoms, this test frequently causes more harm than good, often triggering false alarms and leading to perilous, unnecessary heart procedures. The core issue lies in its accuracy. Studies revealed that in adults over 70, the false positive rate for stress tests, meaning a problem is indicated when none exists, can soar as high as 40%. This inevitably leads to further invasive tests like angiograms and even unnecessary stent placements or bypass surgeries. A significant 2017 JAMA cardiology study found that over half of all stents placed after stress test referrals were in patients with no real symptoms or genuine benefit. These patients experienced no improvement in survival or quality of life. What they did acquire were higher rates of bleeding, kidney injury from contrast dyes, and prolonged, uncomfortable hospital stays. This was Raymond's reality, a 75-year-old retired postman who remained active with daily walks. He mentioned feeling tired on hills during a checkup, prompting his doctor to schedule a stress test. Unclear results led to a catheterization, where a mild narrowing was found and a stent was placed. That very night, Raymond suffered a severe reaction to the contrast dye, developing kidney problems that confined him to the hospital for 6 days and necessitated weeks of follow-up care. His fatigue remained unchanged. It was never a heart issue. He merely required better hydration and more rest. If you're over 70 and lack classic cardiac symptoms, chest pain during activity, breathlessness on exertion, or a significant drop in energy during light exercise, a stress test might inflict more harm than good. A resting EKG, which examines your heart's rhythm while still, or even a coronary calcium scan, a low-radiation imaging test revealing plaque buildup, are often safer, simpler alternatives. These options are far less likely to propel you into an unnecessary procedure. Now, prepare yourselves, because we've reached the second most dangerous checkup, one you've almost certainly had multiple times, and it's number 2 for a reason. Number 2, the colonoscopy. You might be surprised by this one, but a colonoscopy, which uses a long camera to examine your colon, is often an unwise choice after 70 and almost never recommended past 75 unless specific symptoms are present. The risks escalate with age. The preparation alone is brutal, involving potent laxatives that can induce dehydration, debilitating dizziness, or kidney complications. The sedation administered during the procedure poses additional hazards to the brain function of older adults. Most surprisingly, the test itself can cause complications like bleeding, tearing, or even dangerous heart rhythm disturbances during sedation. A 2019 JAMA internal medicine study following over 1.3 million Medicare patients aged 70 and older found that for every 1,000 colonoscopies performed on those over 75, only 2 lives were saved, yet over 20 people suffered serious complications. That's an alarming 10-to-1 risk-to-benefit ratio. Even when polyps are discovered, many are small and slow-growing, and removing them in an older adult can sometimes cause more harm than leaving them undisturbed. Consider Dana, a 73-year-old grandmother who ran a small bakery, symptom-free and with no family history of colon cancer. Her new doctor, fresh from residency, urged a screening colonoscopy. She reluctantly agreed. During the procedure, a small polyp was removed and she was sent home. That night, intense abdominal pain struck and she fainted. At the hospital, a bowel perforation was discovered. She endured 9 days of recovery, lost 10 pounds, and has never been the same. Our review revealed she had 2 clean colonoscopies in the past. There was simply no justification for a repeat. The U.S. Preventive Services Task Force now advises discontinuing routine colon cancer screening at 75 for most individuals. For those in excellent health, a stool-based test like the FIT test, a non-invasive home fecal test, offers a far safer alternative. It requires no harsh prep, no sedation, and effectively identifies most concerning cases. Always inquire about alternatives with your doctor, because once you're caught in the colonoscopy pipeline, escaping can be incredibly difficult. And now, we arrive at the most overused, most perilous, and most detrimental checkup for seniors, a test you've almost certainly had done.
Number 1, annual full-body CT scans. Often marketed as part of executive health packages or preventative services in private clinics, these full-body CT scans are touted as the ultimate early cancer detection tool. But here's the truly shocking truth. These scans bombard your body with a high dose of ionizing radiation. For older adults, especially those over 70, the risk of triggering unnecessary follow-ups, invasive biopsies, and even life-altering surgeries is extraordinarily high. And the bitter irony? There is absolutely zero scientific evidence that full-body scans performed without symptoms actually save lives. Each scan delivers a staggering 10 to 20 millisieverts of radiation, equivalent to roughly 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the surging use of CT scans across the United States may now be responsible for up to 5% of all cancers, placing them on par with alcohol as a cancer-causing factor. This means 1 in every 20 cancers could be induced by a scan intended to prevent disease. That's not just counterproductive, it's utterly terrifying. These scans frequently detect harmless nodules, calcifications, or cysts, mere natural byproducts of aging. However, the instant they are seen, a red flag is raised, initiating a chain reaction of more scans, then biopsies, then sheer panic. Let me introduce you to Marcus, an active 80-year-old martial arts teacher who felt fantastic and participated in a senior elite checkup. His full body scan revealed a tiny 3-millimeter nodule, which ignited a devastating chain reaction. He was referred to oncology, underwent a PET scan, and eventually a needle biopsy. The result? Benign. But the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery, all for something that could have been left completely alone. Experts now unequivocally advise that full-body CT scans should never be used for general screening in asymptomatic adults. The American College of Radiology is clear: there's no proven benefit and significant potential for harm. If symptoms like unexplained weight loss, coughing up blood, or visible swelling are present, then targeted imaging makes sense. But scanning the entire body without focus is akin to searching for treasure with a landmine detector. You might find something, but the damage could be far worse than what you sought to avoid. A safer, smarter approach is simply listening to your body. If you feel well, maintain regular checkups with your primary doctor and only undergo tests that are clearly indicated. Your time, energy, and precious health are too valuable to squander on fear-driven screenings that could leave you worse off than when you began. So, there you have it. 5 checkups that, while seemingly helpful, can actually inflict damage, especially once you're past 70. Modern medicine is incredibly powerful, but it is not infallible. Sometimes, less truly is more.
Always ask, what happens next if this test finds something? If the answer is ambiguous, or if the risks outweigh the potential rewards, it's imperative to pause and reconsider. And remember, genuine prevention begins with your lifestyle. Stay active, eat nourishing foods, sleep deeply, and select your checkups with profound wisdom. Now, we genuinely want to hear from you. Have you or a loved one ever experienced complications from a medical test or treatment that later proved unnecessary? What happened? Share your invaluable experiences and insights in the comments below. We're truly eager to hear them. Thanks for watching.